Welcome to the Woman's Connection. I'm Barrie-Louise, Switz, your moderator. The Woman's Connection is a program about events shaping women's lives and helping one gain authentic power on a personal or professional level. So won't you stay tuned? Welcome to this segment of the Woman's Connection. With me is Dr. Karen Schwartz, endocrinologist. We're going to talk about menopause. And Karen, thank you so much for joining me.
It's my pleasure, Barrie.
Before we start talking about menopause and symptoms and therapy, etc., why don't we talk about how you became a doctor? I would love you to share it with our audience. I think it's a great story.
Thanks. Well, coming from an upper middle class Jewish background from Long Island, I did the thing I was supposed to do. Went to college for 4 years. And I graduated. I was in northern Vermont, in the sense that I needed to be independent and make my own living, and so I got a job as a bartender.
Well, that's exciting.
Yeah, it was a local bar in a small town in a rural area, and that's actually made me make my decision to become a doctor, and it so taught me the most valuable lessons about becoming a doctor.
Which were?
I learned how to listen to people. Got rewarded for it very highly, so the more I listened, the more tips I got. So I learned how to listen to people, and I saw that people would come in whether they felt emotionally or physically not well. They would come in for treatment.
Psychological treatment type?
Every kind, yeah. Psychological, physical, any kind of ills that they had. They were coming in to sort of get some kind of treatment one way or the other. It was just some numbing or whatever, but I realized that I was good at it, and then to help people more, and that sort of was the beginning of my path.
You decided to go back to school and become a doctor.
Right.
And how did you become an endocrinologist?
Well, it's another interesting story. When I first went to medical school, after about 3 months, I couldn't believe the male-dominated and male-oriented thing that I just embarked on. It was, pregnancy was considered a disease.
A disease?
A disease. Menopause was disregarded. There wasn't a word about it in the textbooks. And it was the whole process was very male-regimented and male-oriented. And there was, I noticed that women who were counterparts, had the same male counterparts, had to work much harder to have the same recognition as male counterparts. In any area of the profession of medicine.
Really?
Yeah.
So
that made me want to become more interested. I became more interested in women's health and women's issues, being a big proponent myself. And as the years went by, thankfully, the women started having a voice of their own, and they started changing the whole world, and including the medical world.
Now that's terrific.
Yeah, people had to listen, and these days a woman who is a practitioner in women's health has a busy practice, has real openings, where a male gynecologist, for instance, can be seen at just about any time.
Because a woman can understand a woman's body better than a man obviously can.
Sure.
So therefore a woman, I think, relates better to another woman in explaining the problems. If you have a pain here, it's like, well, I have a pain, but I can't tell you the name of it.
Right. And women realize that, and women have chosen to go to women doctors more now than men, because they have the choice. And I think it makes sense.
Are women coming into the profession, or is it just that women are finally getting more recognition, the ones that are out there?
Yes, in fact, med school enrollment is about 50% women now.
Oh, terrific.
If not more, yeah.
That's great.
It's good news.
Well, talking about women knowing their bodies more, the baby boomers are getting into menopause. What would you say is the starting age of women starting menopause?
The average age of menopause is 50. Women can start feeling symptoms, though, in their 40s. Even late 30s is a time when women can start feeling their hormones cycling downward and starting to become a little less involved.
What other kind of symptoms would you have besides those?
What, for menopause?
Right.
Oh boy, I think a patient once came in with a list of 57
57
complaints. Yes.
All right.
Starting from mood swings.
Really?
Depression, hot sweats. Fatigue, actually, can be one of the common symptoms of menopause. Palpitations is another common presenting symptom. People come on the verge of divorce, on the verge of being fired. They're just, memory loss is I always forget that one, is a real common complaint. A lot of professors come in most disturbed about their cognitive function being impaired and not as good as it used to be. They just can't think and put things together as fast and as well as they used to.
Does this change after menopause, or does it continue on? I mean, is this
Well,
just like the slow period, or like I said, does it change?
The sweats and the moodiness and the irritability generally is more pronounced in those first 5 years, what we call perimenopause, before your periods actually stop. That sort of calms down after your ovaries actually stop producing estrogen finally, which the definition of menopause is 1 year of no periods. But that moodiness can last at 5 years. And unlucky women, about 10% have hot flashes indefinitely, unfortunately.
Indefinitely?
Yeah, they can. Yeah.
Oh, for women, I mean, because I hear some horror stories about women waking up in the middle of the night just completely drenched and have to get up and change their sheets and all bedding.
Absolutely, and the open the window scene when their husbands are freezing and they're too hot. Yeah, it can be absolutely devastating, and not only is it just you know, a lot of laundry to do, but it disturbs their sleep, and that leaves them fatigued because they're not getting a good night's sleep, and it just drags them down.
Well, let's go back to the beginning. When a woman feels that she's starting perimenopause or menopause, there are certain tests that she should go and have as baseline.
Well, depending on if she's having symptoms and if she's bleeding or not bleeding, you might want to get an estrogen level in her blood to see exactly where her estrogen is, what part of her cycle she's in, or what part of the menopause she's in, and an FSH, which is the pituitary hormone, which elevates when you're in menopause. And there's a certain level of the FSH above which we say that you're in menopause.
Wait a minute, what's an FSH?
Follicular stimulating hormone.
Oh, let's go back to FSH.
You like that one? That's from the pituitary gland. That's the central control of most of the hormones in our body, and that tells the ovary what to do. So those two blood tests, the FSH and the estradiol levels, are the ones we can take from the blood to tell how close you are or if you're actually in menopause. Now,
would you just do that as a common test, or would there be a particular reason that you would take the test? Because I feel sometimes we're over-tested, or I guess it depends on your doctor if you're under-tested.
Sure. Yes, I agree. Sometimes it's not clear whether the symptoms are, you know, that's a midlife sort of time for women. Things are changing in their lives as well, and sometimes they're just their symptoms are not just from menopause. And sometimes, if it's not clear enough, we can sort of establish that that's going on with some blood tests. But that would, and that's not in everyone. You don't need to know that someone has a level to know that they're going through experiencing menopausal symptoms. You can tell by the way their bleeding pattern is. And sometimes if their bleeding is very regular, you might have to go in and do an ultrasound of the pelvis to look at the ovaries and the lining of the uterus. Sometimes they might need an endometrial biopsy if their bleeding is very heavy, which is putting a pipelle right into the uterine cavity.
Wait a minute, what's a pipelle?
A pipelle is just a little
wand?
A little wand, a stick-like gadget, I was going to say. Probably male invented, you know. That takes a little tiny, it has a beveled edge that when you turn it around inside the uterus, it can take some tissue from the uterine lining. It can cause some cramping. We generally give an Advil or an Aleve before we do that procedure. That's just if there's a lot of bleeding, and even after menopause, if there's some bleeding, that test can be done as well. But one of the basic tests that women should have, and I think women that are going into menopause should know what their bone density is, because osteoporosis is one of the risk factors of having low estrogen, i.e. being in menopause. So women should get a bone density at the beginning of their menopause to see where they are, and if there's give us just some more information about whether or not to put those hormones or not, or just add to our decision making as far as what to do.
So many tests to go through.
There's a lot. And a mammogram yearly after 40.
A mammogram after
peeve.
40?
Yes.
Okay.
Yes.
Because I was just going to ask you how often should one have all these tests that you go through?
Right. The mammograms should be tested. The mammogram should be done yearly, especially if someone is going to be on estrogen replacement therapy. But I think with the incidence of breast cancer, as it is, it's an important screening test to have done every year. A bone density can be done 1 every 2 years if there's a stability there and if it sort of stables out. Again, if you're not going to go on hormones or anything to protect your bones besides calcium and exercise, which everyone should be on.
Okay. Well, okay. How much calcium should you have a day?
Well, after menopause, after you've lost your estrogen and you are no longer protected by your estrogen from osteoporosis, you should be on 1,500 milligrams a day of calcium total, and that's including your diet.
Okay. So what happens if you're on more than that, and what foods would you say are really rich in calcium?
Calcium? More than that, your body should excrete the calcium out in the urine, generally. There are some exceptions, of course. People with kidney problems might not be able to handle their calcium as well as others. And there's other few exceptions. But generally, 1,500 milligrams that's quite enough. It's a lot to ask my patients to. I'm happy when they take 1,200 because I know that there's 2 big, huge 600 milligram pills that are hard to swallow, and to take those a day, it's a big deal.
Because you gag on them, it's not a
right. Add to your day.
Right, right.
Yeah.
But what about diet? Even before you go into menopause or perimenopause, what should you be taking or doing to increase your bone density? Well,
calcium-rich foods in the diet include generally anything in the dairy department. Milk, say, an 8-ounce glass of milk has about 300 milligrams of calcium, a full 8 ounce, not just what you put in your coffee during the day. You can't count that as calcium, as much as just drinking a full glass of milk. Yogurt, cheeses, those are very good sources of calcium. And dark green vegetables, broccoli, spinach, all the stuff we love.
Right. Well, what about lettuce? I mean, the different families of lettuce, is that or not?
Well, lettuce, yeah, lettuce is mostly water.
Why you use baby green lettuce?
Use baby green lettuce?
Baby bib.
Oh, with the little frilly things on them.
Yeah.
I don't know if you consider that in the dark green category.
Oh, all right.
But it's not a great source of calcium, let's put it that way. That's all you're going to be eating for vegetables during the day.
I guess I'm changing my diet.
You're going to change your diet. Yeah.
Okay. All right. Now, with diet, people exercise.
Absolutely. The bones need 3 things to grow. They need hormones, as in estrogen, food, as in calcium, and they need stimulation. They need mechanical stimulation. That's exercise, weight-bearing exercise.
So if you do a lot of walking, living here in New York, you do a lot of walking. Is that weight-bearing? Because it's carrying my weight.
Sure, that is weight-bearing. I would like to see you do it on a regular basis, at a regular 30-minute interval devoted just to walking. I mean, if that's part of your day, sure. And that time you have with your time restraints, that's fine.
Oh, okay. Well, instead of hopping the subway or the bus, I'll walk home from wherever I am. I'll figure out how many blocks and figure a mile, and I do a mile in 20 minutes. So
sure, that 30-minute thing a day. That's definitely considered.
How long does menopausal symptoms last?
Well, again, in the lucky the lucky women that have actually, first of all, many women don't have any symptoms, and women generally follow their mother in this regard. If their mother went through menopause with really no sweat,
so to speak,
their daughters usually follow them. But the ones who have symptoms, which are at least 40% of women, usually have them for about 5 years. That's about the average. Again, there are some.
Wait a minute, is that including perimenopause, or is it just menopause?
Yes, no, perimenopause is the time period that most of the symptoms actually occur.
Oh, okay, so after you are in menopause, then you don't have symptoms, so to speak.
Generally, yeah.
Okay, so you're saying saying 5 years.
About 5 years, yeah. No, every woman is different, though, and every woman experiences menopause differently. That's for sure, and that's from my experience as a women's health physician.
Okay, now about sex during this time. A lot of women say it's very difficult, very painful. Is that part of the symptoms, or?
It's part of the symptom of estrogen loss. As your ovaries stop working and your estrogen levels decline, estrogen is responsible for giving your tissues lubrication and moisture. When that's gone, the tissues get dry, the vagina gets dry, and sex can be very painful. The skin in the vagina also gets thin, so dry, thin skin is very painful to have intercourse, and it can be the cause of a lot of infections and a lot of.
So what does one do to counteract this?
Well, lubrication, first of all, during intercourse. It's very important that your partner know that you must be lubricated, either naturally or with artificial lubricants. There's tons of stuff out there, now at least. And estrogen replacement will can give you back your lubrication as you were before menopause. And there's also creams, estrogen creams, that you can insert into the vagina that locally keeps the tissues moist and thicker.
Well, let's just go back a second. Okay, you're talking about preparations for sex, you're talking about diet, you're talking about calcium. How does one differentiate all different products on the market from one another that would be best?
Oh, good question. There used to be a dearth of information about menopause in general, the big M, and now there's really too much information in a way. And there's all these soy products out there.
I was going to ask you about that.
Patients come in one day after the other with their labels, you know. This is what I'm taking, and it's something different. There's just I can't believe how many million different products there are now. The soy products, for one thing, many of them claim to have the 2 isoflavones that are important, genistein and dietazine, and those are 2 important isoflavones. There are 4 altogether, though. It doesn't really matter which proportion or what the relationship of isoflavones to protein or anything in these drinks are, if you like them.
I was going to say, what are they? Okay.
Well, yeah, it doesn't. They're important, and they're actually what estrogens are, which is what soy is they are plant products that act like estrogens in our body. Okay. They bind to estrogen receptors and either act like estrogen or act against estrogen. They're very interesting compounds. So if your estrogen levels are low, they might give you a buzz. A buzz, right.
A buzz.
A buzz. A buzz, yes. They will elevate your levels a little bit. They work on the estrogen receptors, but in a weaker way than our own estrogen does. So it will elevate your levels a little bit if you take these supplements while your estrogen levels are low. If you have too much estrogen, actually downplay your estrogen levels. And that's important for women with a history of breast cancer in their family, or younger women who have a lot of estrogen hanging out, and we would just sort of downtone their estrogen levels. Too much estrogen
is no good either.
Isn't no good either.
Oh my goodness.
Right.
It's kind of like, how do you win? How do you know what is right?
Right, and we don't necessarily know, but there is a balance that we can achieve. We were getting a better idea. Now we've started to do studies on women in the last few years. We're really getting on the ball with that and finding out a lot of information about all these things.
Well, it's now time. And Dr. Karen Schwartz, I want to thank you so much for joining me and learning so much about menopause and the symptoms and everything else. And I hope you've learned something too.